my gosh, am I ever glad to see you.
Not half as glad as I am to be seeing you.
So tell me, how are you doing and what's going on?
Okay, I was, trying everything. Nothing was working. I got on Facebook and this ad come up for something about neuropathy, and it explained it helped nerve damage. So I thought, what have I got to lose? I
Right.
called him, went in, gave him all my reports that I'd given you. Most people use it for neuropathy of the feet, but he has explained to me that other nerve damage, pain and stuff, it seems to have helped. They put these little devices which look like a lobotomy machine. It didn't feel any different than a TENS unit, but he put 4 of them on my quad area. And by the second week, I noticed that I thought I felt something, but and then I thought it might be my imagination. So let's give it a little while longer. I had 24 treatments, and they vary anywhere from 10 to 20 minutes, and I was doing it 3 times a week. And then I started noticing that my IT band wasn't hurting anymore. And then I noticed my balance was better. Then I noticed I could turn my foot to put my shoe on that I couldn't do before.
Oh,
Then you want to hear the real big one? I went to
yeah.
Niagara Falls and climbed up and down all them damn steps.
No way.
Yeah, I did. But normally I wouldn't have gone around a crowd because I was that leery. And then after I got done, I looked at those steps going, you really shouldn't have done that, because they were just made out of wood. And all I could think of is, yeah, I'll end up in Niagara Falls now that I got my leg fixed. But after I got done, other than everything else hurt from crawling around, it did really good. I'm still working. I'm still working out in the pool, and I think I've still got some strengthening to do in it. But it's to me, and that's why I went and had the EMG done. I wanted to make sure it wasn't just wanting to think it was better, but it is. I can wear flip flops now without worrying about my balance. It's just amazing. And I just, I was at my ropes in. I just couldn't find anything that would help it. And when he put that apparatus on there, and it has sponges in it. I've sent her pictures of it showing it moving, but it was like having a baby move in your stomach for the first time. I got so excited because that muscle was moving. So I took
Yeah.
pictures of it.
Now, were the treatments painful?
No, it's no different than a flipping tens unit.
It's just like a TENS unit, so you can
It
feel it, but
you
you
can
wouldn't
feel it.
describe it as painful in any way.
Oh no. And when I went in there, he said, "Are you having pain?" And I said, "No, I'm not having any pain. And if this doesn't work, I don't want to have any pain afterwards. So if you think it's gonna, we won't do it." But
Right.
really, they turn it up like a TENS unit. Apparently the modality is different how it hits your quad. He also, once a week, they do something where they put like vitamin B12, B6. He uses a syringe and he just puts it in that area, just a little bit, I guess. And I don't know if it's that's doing it. It's the Synexus machine, but all the people that have been in there with neuropathy, we all kind of talk. It's helping all of them. He told me of another incident that a guy had had a headache for 10 years. Came in, it must have had something to do with his neck or shoulder. He put it on 3 or 4 times, no more pain. So,
Yeah, the problem with neuropathy is it comes and goes, and so
uh,
all these possibly there's a new treatment every month, and it's
yeah.
just impossible to know because so many people it was going to go away anyway. But you had that femoral nerve damage in your knee replacement surgery from the tourniquet, and it
Mhm.
had been constant for almost 2 years.
Yes,
And
exactly.
Pam, as I remember this, you weren't walking.
I was, but I was being very careful. I would have never gone to a public
Barely.
place. Yeah, barely,
And you
barely.
went from barely walking to climbing Niagara Falls. I
After I,
mean, to
yeah,
me, that's a very positive. I'm gonna have to learn more about this.
yes,
That's exciting. This is the first time in 20 years of practice that anyone has come back to me and said something worked for nerve damage. So
I'm
I'm
telling.
very excited.
I am too. I couldn't say enough. And it's called Arrowhead Physical Medicine. I know they do this. I know
Who's the
they
doctor, or was it a therapist, or who
they
administered
I sent her the card with the name on there. They're physical therapists. They charge this to my insurance as a physical therapy treatment.
it? Right,
And
right.
I get 50 of those a year, but between my knee and this, I'm almost out. So I'm down to 1 time a week now. And then after the first of the year, I'll crank it up again if they think that, you know, it's going to continue to heal. He did mention to me, and I'm going to see if I can get one of my other doctors to order a neuromuscular stimulator, because the TENS unit didn't even touch it. He says this will keep it going more. Plus, I'm doing exercises. Yeah, they're just, I couldn't say enough. I just was so excited that, and this, he said 95% of the time they're finding positive results with it. So,
you know, the vitamin injections, there's been a lot of studies that vitamins, vitamin B vitamins are the same when they're injected as when they're taken by mouth. And you had already done that, as I recall. So I know it's not the vitamins. I know it's not the thing getting better on its own because it had been bad for years.
No.
It had to be that in your case. Now, we always have to take a pause and look at the medical literature. As a doctor, I can't recommend something until I look under the kimono, so to speak. But man, am I excited to learn about this.
I have told them all about you. So,
well, I'm going to go meet them. I want to meet them and find out more for sure.
Yes, they have heard your name, and I guess one of them knew about you. And I said, I'm just so excited. I said, you'll have people streaming in your door, because I can't be the only one. I see them on Facebook in these knee groups that they all sound like they have kind of what I have, but I don't think people would have known. Had you not diagnosed it, I don't think I would have ever figured it out. I just kept telling them it felt like an artificial leg. I couldn't control it. I couldn't move it the way I wanted. Now it is, and I'm telling you, this thing worked for me. I don't know that I'd want to run down the street, but just the fact that I did probably 300 steps at Niagara Falls, all I did was made sure I held on so that I didn't fall into the water. But it was quite a treat, and I didn't use a wheelchair for the airplane this time, which I'd always had to do before because I couldn't walk the long distances, and it's going to take a while to build it back up, and I realized that. But I was so excited, and I've watched your back shows. I know more about backs than I ever need to know, but
well, you know, it is definitely a huge treat hearing from you today about that treatment. I can't wait to learn more about it, Pam.
Yeah.
I'm so grateful to you for letting me know, and I'll definitely learn more and get the word out there. But thank you so much for calling in.
You've got such a good program that you got to
thank you.
Find out what it is. So
I appreciate that.
No problem.
More to come.
All righty.
All right. Thanks, dear. Keep walking. Keep strengthening.
All right, I am. All righty.
Bye now.
Bye-bye.